Sports medicine may sound like a medical specialty that caters solely to serious athletes, but at Spectrum Health, sports medicine encompasses a whole lot more. The team of healthcare professionals at Spectrum Health wants you to know that you don't have to be a long-distance runner or a semi-pro athlete to benefit from their knowledge and expertise. Here to talk about that is Dr. Perry Merillat, an orthopedic surgeon and sports medicine specialist at Spectrum Health. He joins us by Zoom. Good morning, Dr. Merillat.
Good morning. Thank you for having me.
Absolutely. Thank you for your time this morning. Can you define how sports medicine differs from, say, general orthopedics?
Yeah, of course. So in general, for general orthopedics, it incorporates the entire musculoskeletal system, and that includes all tendons, ligaments, muscles, bones, as well as joints. And that can be anything from broken bones or fractures to chronic joint pains and arthritis. And how sports medicine differs in the subspecialty itself, it really focuses on the active individual. And that can range from anyone going on a daily walk to the professional level athlete. And another important aspect of sports medicine is the incorporation and coordinated care between many professionals, including physical therapists, as well as trainers and non-operative sports medicine specialists, as well as orthopedic surgeons.
And Dr. Merillat, you mentioned, I mentioned at the top of the segment that you don't have to be a pro athlete. So what sort of patients do you see? What's the percentage? Are you seeing mainly athletic, or is it just someone who is active and was injured?
Yeah, exactly. I mean, I see everyone from the professional athlete to anyone in between. So I see a wide variety of patients. For example, this morning I saw a high school soccer player who had an ACL tear, and then my next patient was someone who's 55 years old who injured their shoulder while working in a factory. So it can have a huge range of patients. I do care for local area high schools as well as community sports programs. And at Spectrum, we also run with certain organizations like the Grand Rapids Ballet as well as the Whitecaps. So we see a wide variety of patients.
Wow. So from the athletes to those just fixing up stuff around the house. And what specifically is your role within Spectrum Health's sports medicine?
So I am an orthopedic surgeon, so I did some specialized training in sports medicine as well, so with sports-related injuries. And so I do a variety of procedures which may include minimally invasive techniques such as arthroscopic procedures, but I also do fracture care or ligament, tendon, and muscle injuries like reconstructions or repairs, whether it be a meniscus or an ACL or a rotator cuff, as well as some joint replacements for chronic pain, especially with shoulder. My goal when you come to see me is to make sure that the patient is educated on their injury. So I'm going to review important medical history, go over important medical imaging studies like x-rays and MRIs, and then we're going to discuss all treatment options, whether that be surgical or non-surgical. Even though I am a surgeon, there's a lot of conditions, especially with sports medicine, that can be treated non-operatively, whether that be with rest, ice, activity modifications, certain braces, or even some formal physical therapy.
I'm sure those non-surgical therapies are probably preferred, a quicker recoup time. When it comes to sports medicine, taking that word sports may kind of make people hesitate, like, well, I'm not an athlete. So how does someone know if they're a good candidate for sports medicine?
Yeah, I mean, if anyone is questioning whether they're a candidate or not, I think it's just a good idea to get evaluated, whether you're having pain from an acute injury or chronic condition from something overuse or a previous injury. Anyone that's trying to maintain an active lifestyle or just be active can benefit from seeing a sports medicine specialist. Our goal is to take people who like to move and keep them moving.
Well, if you like to move and want to keep on moving, you probably want some more information if you're in that world of injury or maybe the mobility isn't what it used to be. So how can viewers connect with Spectrum Health Sports Medicine? How can they get a hold of you?
Yeah, they can learn more at the website through Spectrum Health, as well as you can see your primary care physician for a referral or do a self-referral. We have sports medicine providers throughout West Michigan and the surrounding Grand Rapids area, all along the lakeshore.
Dr. Merillat, thank you so much for the time this morning. Appreciate it.
Thank you so much for having me.
Absolutely. Again, if you want to learn more, spectrumhealth.org/sports, or as you heard Dr. Merillat say, you can just pick up the phone, even a self-referral. Don't need to have a referral from your doctor. Just call 616-267-8860.